I regularly use rigid frame orthoses for aftercare following an anterior cruciate ligament reconstruction. I use these rigid frame orthoses post-operatively until the end of week 6. Where applicable, I recommend that the patient continues to wear the orthosis after that, in case of elevated strain or for specific activities that could have a negative impact on the cruciate ligament transplant. The problem with cruciate ligament reconstruction is that to reconstruct the anterior cruciate ligament, we use tendon transplants that have been separated from their supplying blood vessels. This means that these transplants gradually die off after the operation and lose their stability. Reconstruction processes take place that further decrease stability, which for the anterior cruciate ligament transplant may be reduced to as low as 6% of the normal tensile strength. During this time, a cruciate ligament transplant should simply be protected, and a rigid frame orthosis is well suited to the job. In addition to all of these biomechanical advantages, knee orthoses have further benefits for the patient. For one thing, the orthosis is a constant reminder to the patient that they have had a knee problem, and that the knee must not be strained excessively. This is particularly important during the later phase. This is the case especially where less invasive operating methods have been used, and the patient therefore forgets about the operation relatively quickly. This reminder effect alone can protect the transplant against overloading by the patient. Then there are patients for whom wearing the orthosis provides added safety in the course of post-operative aftercare. There are even patients who, for psychological reasons, are difficult to later wean off the orthosis. That does happen. Even though various clinical studies have shown that movable knee orthoses have no clinical benefit, or to word it a better way, that they have no impact on the clinical result, on the measured clinical result after anterior cruciate ligament replacement surgery, I use them anyway. About 2 years ago, we conducted a survey among the instructors of the German language study group for arthroscopy, the AGA, and asked those instructors about the use of rigid frame orthoses within the scope of aftercare following anterior cruciate ligament reconstruction. It turned out that in spite of these study results, 3/4 of all AGA instructors use a rigid frame orthosis in the course of post-operative aftercare. There were even colleagues who recommend this rigid frame orthosis right up to the point where the patient is allowed to resume their regular sporting activities. So the question is, can all these physicians be wrong? I would even say that an excursion into fundamental research shows this may not be the case. If we just take a look at what happens to a cruciate ligament transplant when it is implanted, it really becomes clear that this, the body's own tendon, the semitendinosus tendon, quadriceps or patella tendon, is separated from its supplying blood vessels following removal. And what happens when tissue is separated from the supplying blood vessels? It will die off, partially. Which means this transplant turns necrotic. But then it is slowly reconstructed in a process called remodeling. During remodeling, the mechanical stability of the cruciate ligament transplant decreases rapidly. It drops to as low as 6% of the normal tensile strength of the transplant, or even of the anterior cruciate ligament. This process takes place in the first 6 to 12 weeks, and that means the cruciate ligament transplant ought to be protected during this time. Rigid frame orthoses are suitable for providing this protection for a variety of reasons. One reason is the stress behavior of the anterior cruciate ligament. When we examine the stress behavior of the anterior cruciate ligament, it turns out that there are stress peaks at pronounced extension from about -5 degrees of extension and also in flexion from 90 degrees. What this means is that if we can limit movement in those two directions but nevertheless allow mobility, we are already protecting the transplant. And there are also more recent biomechanical studies, applied biomechanics with test subjects, which have shown that a rigid frame orthosis can improve the rotational stability of the knee joint. Georgoulis was able to show this. There is also other work which has shown that ground reaction forces decrease, that the ability to balance and also the development of force can be improved with the use of rigid frame orthoses. For me, there are sufficient reasons to use these orthoses in aftercare following anterior cruciate ligament ruptures, or, more accurately, after anterior cruciate ligament reconstruction.